If somebody is able to be addicted to a substance, we have them here. We have people that are addicted to crack cocaine. We have people that are addicted to powder cocaine. We have opiate users. We have people who use Xanax and they're addicted to Xanax. We have people who deal with sexual addiction, gambling addictions, heroin addiction, you name it. As far as if you're able to get addicted to something, we have those people here, and we also have the staff to help them overcome those different addictions. We have a lot of clients that come here that went to the dentist and got maybe a root canal, and the dentist prescribed Percocet, and they started taking the Percocet, and the Percocets led into Oxycontins, and the Oxycontins led into heroin. The progression of the disease is just that. It's progressive. And if someone's addicted and has addictive personality, it usually progresses from something as minor as going to the dentist or getting some knee surgery and getting prescription medication. And then they end up actually doctor shopping, where they're going to multiple doctors and they're getting prescribed medications. And some of them are selling them, some of them are using them. But in the end, they always end up using them. That's how a lot of people overdose, is because of the prescription medication overdoses. The progression of the disease will lead you into three places, and that's jails. You'll spend time in prison, or institutions, where maybe it's mental institutions or treatment centers, or eventually it's fatal, and it'll lead you to death. Those are the three options that an addict has. The other option is recovery, and it's the option that takes the most work. It's an inside job. There's nothing external about recovery. It's digging through the wreckage of the past, working through the issues, finding solutions, and incorporating a 12-step program in your life and a higher power, who I choose to call Jesus Christ. There are a million triggers out there, from a 7-Eleven on the corner to a McDonald's that you might have used. People they shoot dope and they shoot heroin in the McDonald's bathrooms. It could be a television show that they got high to. It could be the computer. I know a gentleman who was doing a lot of computer work and was using speed all night long as a web designer. There are so many external triggers, but what we're teaching them at Transformations is how to use the tools to overcome those, whether it's picking up the phone and calling a sponsor, going to a 12-step meeting, going to church, praying, meditating, journaling. There are so many tools that we need to equip our clients with in such a short period of time that we're basically working around the clock to do so. When we get a phone call from a person who's struggling, whether it's a family member or someone who's in active addiction, we have an assessment form that we fill out. We'll ask them what their drug of choice is, how long they've been using, what duration, the amount of drugs they've been using. Do they need detox? If they need detox, then we need to place them in a detox. Otherwise, we can do an outpatient detox for opiate users, where they would take Suboxone and they would taper off. There's a multiple of questions we need to find out before we actually admit them into our program. The Christian drug treatment program is absolutely optional. A lot of people come to us, they have no concept of God, no concept of a higher power, and that's okay. We meet them where they are. But you will find that most people, by the time they leave the program, have some form of higher power, some form of God. Some even profess Jesus Christ as their higher power by the time they're done here at Transformations. We are very concerned about getting them off drugs and alcohol, but we're also concerned about their soul and their lifestyle and the way they're going to carry themselves as far as living by principles in their lives. Honesty, open-mindedness, willingness, having love for your brother. We want to teach them not only to get off drugs and the tools that they need to get off drugs, but also how to live a clean and successful lifestyle.